Assalamu alaikum and a very good afternoon from FIU Islamabad. This is Hina Shekhani, your host for today's session. Today we're going to have a very interesting theme, that is Smile Pro, myth versus facts, where we're going to debunk some of the misconceptions that you and I have about Smile Pro and what could be the possible answers to the questions that you have been thinking. With me today I have Pakistan's one of the expert ophthalmologist who is a renowned surgeon in refractive and vitreoretinal surgery, Dr. Mushtaq Ahmed. Professor Dr. Mushtaq Ahmed, welcome to the session today.
Thank you so much.
Dr. Mushtaq, today's session is going to be particularly about Smile Pro, जो कि हमारे viewers हैं जिनके concepts होते हैं हमारे साथ social media पे वो share करते हैं, and we want to clarify those questions today. But before that, I want you to let us know about your journey as a surgeon.
ओके, थैंक यू सो मच है ना। मेरा इंट्रोडक्शन ये है कि मैं डॉक्टर मुश्ताक एसोसिएट प्रोफेसर था हैबर गर्ल्स मेडिकल कॉलेज और हैदराबाद मेडिकल कम्प्लेक्स में। फॉर द लास्ट 3 years आई हैव रिजाइंड द एसोसिएट प्रोफेसर पोस्ट एंड आई हैव मींस बिल्ट FIO हॉस्पिटल देयर इन पेशावर हैदराबाद। उसके बाद मैंने स्टार्ट लिया इस्लामाबाद में। अभी हम इस्लामाबाद में बैठे हुए हैं, इस्लामाबाद FIO में, और इंटरव्यू कर रहे हैं।
Wonderful. Thank you so much, Dr. Mushtaq. बिल्कुल आपका जो journey है, we have been through that. You know, you started as a very junior consultant. Now you're, mashallah, CEO of 2 specialized, I would say, hospitals. That is FIO. That is soon going to expand into the national and maybe soon into the international. So,
Yes.
Dr. Mushtaq, today we're going to have a session that is going to be very interesting and engaging as well. You have with you a flip card that I would say. I
Yeah.
would request you
You have already
that.
given that for me.
Yeah, absolutely. So I will be asking some of the questions from
Yes.
you, and we want you to answer that. Are those misconceptions a fact or are they a myth? So
Yeah.
that our patients who are really keen to get their Smile Pro done, they can make an informed decision.
Okay.
My very first question is Smile Pro a painful procedure? Is it a myth or a fact?
This is myth.
And why?
Because Smile Pro, there is no cut in a Smile Pro. Smile Pro is a 9-second procedure. They make a lenticule inside the cornea, and we just loosen the lenticule and then remove it in 30 seconds. Probably in average time, my time is 30 seconds.
Okay, wonderful.
Yeah.
So it's one of the latest technologies that's so
Because
far.
there is no cut in the cornea. This is just a lenticule inside the cornea is made. And the second thing is only small incision, 2 millimeter, is given, but for that purpose we put in a drop, anesthetic drop.
Okay.
So we loosen the lenticule and then remove it.
So
This
there
is
is
the
no
whole
proper anesthesia during this
no proper
procedure.
anesthesia, just putting the drops.
Also, I would say there is another concept as well, that mostly the patients say that the Lasik and the Smile Pro, both are the same procedure. So what do you think? Is Femto Lasik and Smile Pro same procedure?
This is a totally myth. Because the Smile Pro and Lasik, they are totally different mechanism which they correct the vision. In a Lasik procedure, we gave almost 20 millimeter incision over the cornea surface, and then we flip the flap which is made, elevate it, and then we apply a laser for correction, which is called excimer laser, to ablate the cornea, burn out the cornea. This is the mechanism of Lasik. It cut the cornea, the nerves over the cornea.
Right.
While in a Smile Pro, this is just a lenticule formation inside the cornea. The second laser, which is called excimer laser, it's not used in it. No ablation, no burnout of the cornea. So we just remove the lenticule.
Wonderful. We've also heard from the statistics that has been shown that so far you have done almost 1,000 Smile Pro cases. So as a surgeon, how has been your experience with that?
I have a wonderful experience. As an ophthalmologist, if I am saying by myself, I have a really very good experience, because the one thing which I'm feeling is whenever I'm doing the PRK, LASIK and Smile Pro, in a Smile Pro, I have a mental peace because there is no fear of flap elevation, and no fear of any wound formation over the cornea, such as in a PRK. And a Smile Pro, this is just a 2 millimeter small neck, which heal almost in an hour. So this is a mental peace for as a surgeon to me as well, and the patient mental peace and comfort.
We also receive certain questions from the patients as well, that their query is that, for example, if there is a patient that has undergone this procedure, Smile Pro, and there is still, some vision problem in them. So can it be recorrected, or is there a certain procedure that could be done once the patient has undergone Smile Pro? And there is a fault in the correction, in the Smile Pro. So can it be recorrected or no? It's a permanent one.
Yeah, up till now, I have done almost 1,000 cases, but I haven't faced such a case. But if there is any problem, means overcorrection, undercorrection, or docking loss, for example, occur in Smile Pro, then there is a procedure. Then you can go through circle, elevate the flap and give like a Lasik, or you use even sometime in a docking loss. I have gone through this one patient.
Right.
In a center, the patient has when there is a movement and docking loss occur.
Right.
But then we again redocked and the Smile Pro procedure completed.
Means
Yes,
there is a
can,
solution
it
for
can
that.
be done. But if there is under correction later on, there is any problem, then we can give some PRK like direct laser to the
So means the patient shouldn't fear about,
no
of
fear.
anything.
It can be corrected.
Okay,
yes.
wonderful.
Yes.
The next question that I'm going to ask is, Dr. Mushtaq, like mostly the patients that undergo the Smile Pro procedure, so their query is mostly before the, surgery. Can they resume their normal life activities like, going through their screens, computer, like swimming or driving the very next day or not? Is it a myth or a fact?
It's a fact. Patients can go next day, each and everything. They
Right.
can use their mobile. Even I can advise them that do a driving even.
Okay.
Yes, because next day, almost 95% cases, the vision is 6/6.
Okay.
There is a little bit haze in the vision. And sometimes there is halos or glare.
Right.
But it's temporary. It usually fade out. In our setup, I have done 14 cases of my employees in one day, but I have given no leave, even a single day to anyone. Yes.
So you just said that, yes, for a short period of time, there is the haziness. So what is the, like recovery time that can be gone?
The vision is usually the 6 to, if we say in a day, in 24 hours, vision is 6/6. But the haziness is due to healing process. When a lenticle is removed, the two surfaces become healed. So the haziness, a little bit haziness occur for 2 weeks, 3 weeks, and then they fade out almost 100%.
Right.
Yes.
Thank you so much. The next question that I'm going to ask is it a myth or a fact that Smile Pro is only for the young people?
This is totally bad. This is for old people, those people who do, for example, a lens surgery, like जिस तरह हम कहते हैं कि मोतिया के ऑपरेशन. All those cases, all those patients who do their lens surgery for cataract, phaco surgery, and they have not corrected their vision and they use as a glasses, they are a candidate for Smile Pro and LASIK.
Okay, means patients with nearsight vision, that they have, like problem with the nearsightedness. Yes. Can that be corrected with Smile Pro or not?
No, for nearsighted, for near vision, now we have a meeting on 10th April in Riyadh, Saudi Arabia. Okay. All the expert refractive surgeon, they have a meeting, and we will even practice over the press beyond. This is another procedure, press beyond.
Okay, so will it be introduced in FI or this, like advanced technology?
Very soon after FDA approved.
Okay.
Press beyond will be started.
So it's a good news for our patients as well.
This is a very good news for near. Even I'm also a patient of presbyopia.
Okay, wonderful. Yes. My other question would be, that is, I would say, a very primary concern or query of all the patients who want to do this procedure is, there is a concept that Smile Pro is way costly procedure. So what do you think? Is it a fact or a myth?
If I can say that this is a myth and it's a fact as well,
Right.
because there is a license which is used in Smile Pro procedure. The company charge for that in euro.
Right.
So it is a costly procedure, but if I can say that this is one of the place here in Pakistan, I can means claim it that this is the lower cost all over the world. You see it here. Our center have a lower cost.
Right. So
Yes.
means it's a fact and a myth as well, depending on the patient.
Yes.
Okay, perfect. Dr. Mushtaq, my next question from you would be that is it a myth or a fact that Smile Pro is still in the experimental stage, this procedure?
No, this is a myth because Smile Pro is now FDA approved. It's widely practiced in America as well. And in the whole world, almost more than 6 million people have done this procedure.
Okay, wow.
And most of the means people are converting over the Smile Pro.
Right.
Because this is now FDA approved and this is a well-established procedure.
Okay.
Yes.
Also, following that, I would like to now ask some of the questions that we get online and even in person when the patient visit is. Mostly there is a query that who is a perfect eligible candidate for this procedure? And if there's a patient, who is that patient who is not eligible? What are the factors that makes it unfit for this procedure? So for those patients, what are the alternative procedures that could be advised?
Okay. So those people who have a keratoconus or corneal thickness is very thin. So these people are not eligible for Smile Pro procedure. Second, those people who have a mixed astigmatism or mixed number, plus and minus number, or even plus number, they are not a fit candidate for Smile Pro. The alternative procedure is Lasik or PRK.
Okay, means there is an option for them that they can opt to. And if you can clarify, what is the ideal age for this procedure?
The ideal age is depending. If the number is stable, if the glasses number is stable, at least 6 months, then the ideal age is from 18 year to 50 year. Then we can go for Smile Pro.
Right. So far that you have done, almost 1,000 cases of Smile Pro, have you had any experience where a patient came up to you and asked you a question that was a bit worrisome, however, at the same time funny as well? Was there any patient?
Yeah, patient usually when they do Smile Pro, they sometimes come that we have not even outside, we have not gone outside of home, even I have not taken bath for a week. So this is like, because in a Smile Pro, I think nothing is needed, no restriction. Even you can go for, next day you can go for driving, for screen using, for each and everything. You can do it.
Perfect. Yes. Dr. Mushtaq, we have also, experienced it that there are a lot of people, even particularly ophthalmologists or own young ophthalmologists as well, who do wear glasses, the far distance or they are myope. However, they still resist to go under this procedure. So as a surgeon, what do you think? What could be the possible reason that they are scared of this procedure and what would be your advice to them?
Yeah. Most of the ophthalmologists, especially young ophthalmologists, yes, they are using glasses. But the thing is that previously the procedure were PRK and LASIK. Most of the ophthalmologists knows about these two procedures. Smile Pro, I think this is a specialized field. Specialized field unless you not even have a training or you not read it. So you have no knowledge about it. Because there is dryness and the other problem in LASIK, like a flap problem, and PRK problem. So the ophthalmologists are worried, most of the ophthalmologists, because they have no knowledge. My advice to all those young ophthalmologists is to remove your glasses through Smile Pro, because Smile Pro is one of the safest and the latest procedure, because they have I have done almost 1,000 cases. I haven't seen any such case that they have any problem like dry eyes, or there is any under overcorrection, or there is a flap problem. Nothing like this in a Smile Pro, because this is one of the safest procedure. So I advise all the ophthalmologists to come and go through the Smile Pro.
Okay,
Yeah.
wonderful. Dr. Mushtaq, also, since this technology is the latest one that is available only at FIO in Pakistan at the moment, and most of the Smile Pro patients we've seen are from the overseas Pakistani as well, right? So their query is, are there any follow-ups required post the Smile Pro surgery or not? Because they have to travel, most of them have to travel back to the country from where they came from. So is there any follow-up required after the Smile Pro?
My advice to all those people who want to do a Smile Pro, there is no follow-up required. So we not usually see any post-op Smile Pro cases. If there is any query or there is any means problem, especially the people are coming for post-op a haze which is temporary, but they come again to assure themselves. So we give advice over it and then they become satisfied. So there is nothing needed, even a follow-up.
Okay, wonderful. Thank you so much for being with us in this session today, Professor Dr. Mushtaq Ahmed. Before we wrap up this session, I want to ask you any final words or any message that you want to give to our viewers that are watching us right now, and any call for action.
You have done Smile Pro,
Yes.
probably.
Yes.
So call for action, I think you can give very beautifully.
Right. So yes, I've personally gone myself through this Smile Pro procedure, and that is the reason that I'm sitting here today and smiling in front of the camera without the glasses. It has helped me in my professional and my personal journey as well, and I would recommend this to anyone if they really want to, like live a life that is free from glasses and enjoy every moment with precision and accuracy. So yes, and thank you to FIO for providing us that technology and platform to really have this facility. Dr. Mushtaq, my last question from you as a surgeon, as a CEO of FIO, is what is your future regarding FIO? Where is FIO going now?
We have established FIO at Peshawar, and I'm proud of it कि इस तरह का एक ज़बरदस्त सेटअप है जो कि पेशावर के लोगों के लिए खैबर पख्तूनख्वा, even Afghanistan is dependent over it. So I'm proud of it कि पेशावर में वो बहुत बेहतरीन तरीके के साथ एक टर्शियरी लेवल सर्विसेज जो हैं we are providing there. Second, we have opened this in Blue Area Islamabad. Blue Area Islamabad, tertiary level services and refractive Smile Pro services here in Islamabad. After Islamabad, we have now launched the FIO at Shahra Faisal, Karachi, and very soon we will start there in Karachi as well. And my vision in FIO is to help those people which are especially young and they are fed up of their glasses and they are handicapped the one way through the glasses. And inshallah, this is Smile Pro is one of the best procedure, and we will remove all the young जो कि पाकिस्तानी हैं और पाकिस्तान के लिए काम कर रहे हैं, स्पेशली ओवरसीज जो हमारे बहन भाई हैं. इंशाल्लाह दिस प्रोसीजर के जरिए हम इसके ग्लासेस रिमूव करेंगे और ये मेरा मिशन है और ये मेरा विजन भी है. Thank you so much, Dr. Mushtaq. I think we're proud of you as well. Pakistan is proud of you that you have introduced this technology. So thank you for your time. And thank you so much, everyone, for joining us for the session today. We're at the very end of this session. And I hope we have cleared some of your misconceptions that you have. Still, if you're interested for this procedure, don't hesitate to visit FIO Hospital, Peshawar, Islamabad, and soon Karachi, and get rid of the glasses and live a life that is beyond limitations and in a perfect way. So thank you. Have a great evening and Allah Hafiz.